I welcome the opportunity to address the Ebola crisis in West Africa and to update the House of Commons on our government's action to date. Mr. Speaker, I will be sharing my time today with the member from Elmwood, Transcona. The outbreak continues to be a very serious situation, and our thoughts are with those affected by this. Recent statements from West African researchers, scientists, clinicians, and health officials underscore the fact that families and entire villages have been shattered. Canada remains at the forefront of the Ebola response, contributing funds, expertise, and equipment to the international efforts to fight the Ebola outbreak. Our government continues to work with domestic and international partners to ensure the most effective response to the Ebola outbreak in West Africa. We also continue to take steps here in Canada to further protect Canadians right here at home. I'll start off by reiterating that there are no confirmed cases of Ebola in Canada, but Canada must be prepared for a case to come here. Provincial and local health officials are the lead on any Ebola case in Canada, but the Public Health Agency of Canada continues to assist. The Government of Canada has a number of systems in place in Canada to identify and prevent the spread of infectious disease like Ebola, and will continue to work with the provinces and territories to ensure that we are prepared to protect Canadians in the unlikely event that a case were to arrive in Canada. We also have 5 Ebola rapid response teams in place, which include epidemiologists, lab expertise to quickly confirm diagnosis, and emergency supplies from our national strategic stockpile, such as masks, gloves, and gowns. These rapid response teams would support the provincial and territorial authorities in their response should a case of Ebola occur. Internationally, we are supportive of the leadership role being played by the World Health Organization and remain committed to working effectively with them and other key partners, including Médecins Sans Frontières and the Red Cross, to respond effectively to this public health emergency. Canada has been providing financial and in-kind support of humanitarian, security, and public health measures since April to address the spread of the Ebola virus in the West Africa region. On October 17th, the government announced an additional $30 million to support international efforts led by the United Nations Mission for Ebola Emergency Response, or UNMIR, to help strengthen global efforts to stop the outbreak, treat the infected, and prevent the spread of the Ebola virus disease in West Africa. With this most recent announcement, Canada has committed a total of $65.4 million to the global efforts to support health, humanitarian, and security interventions to address the spread of the disease. Mr. Speaker, the government continues to assess the needs identified by the WHO and to explore what else Canada can do to support global efforts in response to the outbreak. As you are aware, the agency's National Microbiology Laboratory in Winnipeg is on the cutting edge of global research and testing capabilities for Ebola, and the lab recently sent a second mobile laboratory to help provide on-the-ground rapid diagnostics and testing infection control measures. In response to the World Health Organization's appeal to member states for the donation of personal protective equipment to support the ongoing Ebola virus disease outbreak response in West Africa, the Government of Canada offered to the WHO a donation of over $2.5 million in personal protective equipment, including gowns, masks, respirators, and gloves. 2 shipments have already been delivered to West Africa, in part by a Royal Canadian Air Force Hercules aircraft. This personal equipment will make a difference on the ground in helping to reduce the risk of transmission and infection. The Government of Canada is also donating up to 1,000 vials of an experimental Ebola vaccine developed by the Public Health Agency of Canada to the WHO to support the response to the ongoing Ebola outbreak in West Africa. The Government of Canada owns the intellectual property of this vaccine. The vaccine is the product of more than 10 years of scientific research and innovation by Public Health Agency of Canada scientists at the National Microbiology Laboratory, and could be an important tool in curbing the outbreak. The experimental Ebola vaccine has never been tested in humans, but has shown great promise in animal research. This donation represents up to 2/3 of the total vials of this experimental vaccine currently in the possession of the Public Health Agency of Canada. The remainder will be kept in Canada for further research and in the unlikely case that it is needed for compassionate use. The Government of Canada has begun to ship 800 of these donated vials of its experimental Ebola vaccine to the WHO. The first shipment left yesterday via air from Winnipeg to the University Hospital of Geneva. The vaccine vials are being sent in 3 separate shipments as a precautionary measure due to the challenges of moving a vaccine that must be kept at a very low temperature at all times. The vaccine must be packed in dry ice and kept at -80 degrees Celsius, which is similar to the conditions required for transplanting human organs. Mr. Speaker, the Public Health Agency of Canada is supplying the vaccine to the WHO in its role as the international coordinating body for the Ebola outbreak, in the hopes that the vaccine can be made available as an international resource. The Government of Canada views this experimental Ebola vaccine as a global resource, and in the interest of global public health, we are sharing it with our international partners to help address the outbreak. The WHO, in consultation with partners, including health authorities from the affected countries, will guide and facilitate how the vaccine is distributed and used. There are both ethical and logistical challenges with the use of experimental vaccines and treatments in humans, and the WHO will need to consider those carefully before using this vaccine in this outbreak. We are mindful that the vaccine is experimental. There have only been a handful of people in the world who have received it to date. It has not yet been tested in humans for safety or effectiveness. All of that to say we expect the WHO to deploy these doses as ethically, quickly, and safely as possible. To this end, the WHO organized an expert consultation in late September to assess the status of work to test and eventually license this Ebola vaccine, along with another developed in the United States. More than 70 experts, including many from affected and neighboring countries in West Africa as well as Canada, attended this event. Participants had varied backgrounds and were able to provide expertise ranging from the virology of emerging infections to regulatory requirements to medical ethics, public health, and infectious diseases. Some participants came with more than 3 decades of experience working in Africa on other infectious diseases. In order to clarify the safety of the vaccines, the WHO, these experts, and other partners have helped to facilitate the expected evaluation of the 2 vaccine candidates in order to generate phase 1 safety and dosage data for decision-making. A series of coordinated phase 1 trials is currently underway, and others will soon be initiated with international partners at more than 10 sites in Africa, Europe, and North America. These trials, which are being conducted in healthy volunteers, will provide critical information about the safety of the vaccine and the appropriate dose is required to stimulate a person's immune system to produce Ebola antibodies. Results from the clinical trial are expected in December 2014. Mr. Speaker, our government is committed to supporting our international partners' efforts to control the Ebola outbreak and hopes that the experimental vaccine will be able to address this global crisis. In conclusion, Mr. Speaker, that we recognize that the Ebola outbreak currently ravaging parts of West Africa is the most severe acute public health emergency in modern times. Canada, with its partners, is well prepared and ready to support international efforts in West Africa. Thank you, Mr. Speaker.